Patient A is a 23-year-old male. While working, he was struck on the right shoulder and back by a falling object weighing over 500 pounds. He was taken to the hospital and a CT scan was performed, which was found negative, and so the patient was released. When the patient tried to get out of bed the morning following the accident, he fell and could not walk. A neurological assessment, MRI, and eye evaluations were performed, but were found to be negative. In the weeks that followed, the patient stopped driving because his car drifted to the right. He also continued to report that there was something wrong with his eyes. A year and a half after the accident, he was referred to the Padula Institute of Vision Rehabilitation for a neurovisual processing assessment. This video documents the event that evening from the examination and diagnosis of a visual midline shift syndrome, or VMSS. This syndrome is a mismatch and dysfunction of the spatial visual process in conjunction with the proprioceptive base of support, causing the spatial visual process to shift the ego center, affecting the center of mass. Yoked prisms were introduced in spectacles to realign the center of mass. The result is seen in the change in posterior alignment upright against gravity. The patient wore the strong therapeutic prism, 18 prism diopters shown in the video's second demonstration, for only 2 hours per day, as well as a conventional-looking pair of glasses with a lower amount of yoked prism, 8 prism diopters full-time. He returned for follow-up visits, and the prisms in the therapeutic glasses were adjusted accordingly. 1 year and 3 months after the beginning of treatment with yoked prisms, the therapeutic prism glasses were discontinued and the conventional prism glasses were re-prescribed with 1 diopter of yoked prisms. Patient B is a 44-year-old female. This patient suffered whiplash from a rear-end auto collision, which resulted in spatial disorientation, vertigo, and difficulties with balance. Physical therapy was recommended following a neurological assessment. Despite the therapy, the balance difficulties and vertigo persisted. The patient was referred by a physical therapist to the Padula Institute of Vision Rehabilitation for a neurovisual processing assessment. The assessment determined a spatial visual processing imbalance with a diagnosis of visual midline shift syndrome affecting posterior alignment and balance. The drifting is associated with a shift in the spatial visual process ego center, affecting the center of mass and causing the patient to drift when walking. Yoked prisms were introduced to affect the visual spatial ego center that realigned the center of mass. The outcome was increased weight shift toward the affected side, posterior alignment upright against gravity, and ambulation without drifting. The patient wore the yoked prism glasses for 6 months in conjunction with physical therapy. Following this, the prism glasses were recommended for 2 hours per day, and the patient was placed on follow-up. Patient C is a 17-year-old female. She was diagnosed with Lyme disease and treated with antibiotics. The patient was referred for evaluation of a neurovisual processing dysfunction due to consistent difficulties with balance and spatial orientation. The evaluation found low posterior tone with an anterior shift in the visual midline affecting ego center and posterior alignment. The erratic movement can be seen with scissor stepping, drifting to the left and right during ambulation. Flexion can be noted in posture, with a tendency to fall into each step. Yoked prism lenses are introduced in a trial frame, and the effects show slight improvements in posture with less drifting. The patient was prescribed yoked prism glasses, 8 prism diopters, for full-time wear. During the successive months, the prisms were realigned to affect the changes in the visual midline shift as improvement occurred. The second video of the patient shows improvement over time from using the prism glasses despite the persistent infection from Lyme disease. The final footage shows the patient walking without glasses. It should be noted that she continued to be treated for the persistent Lyme disease. Patient D is a 55-year-old female. The patient was in a severe auto accident wherein she was T-boned by a semi-trailer truck traveling at approximately 55 miles per hour. The patient was taken to the hospital and treated for fracture of the left clavicle, a cervical injury, and fracture to the C3 vertebrae. She was diagnosed with a traumatic brain injury, or TBI. The patient was hospitalized and received physical and occupational therapy as an inpatient, as well as an outpatient upon release. The patient continued to have postural imbalance, difficulty with balance and movement. She was referred to the Padula Institute of Vision Rehabilitation for a neurovisual processing assessment 1 year after the motor vehicle accident. The evaluation found a shift in the visual midline to the left and anterior reinforcing postural misalignment and difficulties with balance. Of particular interest, it can be seen that the patient has an abnormal high postural tone throughout her body. The tone increases as she attempts to walk, causing a tremor in her arms and hands. A low amount of yoked prisms were positioned in trial frames to affect the spatial visual processing and balance. As shown in the video, this results in an almost immediate reduction in the high abnormal postural tone. The patient becomes more erect in posture, and there is an increased weight shift to the right side, affecting posture and balance. The removal of the yoked prisms shows an immediate return in the high abnormal postural tone and difficulty with balance and posture. The patient was treated with 3 diopters of yoked prisms. Improvements in balance and posture with reduction in abnormal postural tone continued. However, if the prisms were removed, the abnormal postural tone returned. The patient improved but continued to report pain in the cervical area. Further evaluation determined a cerebral spinal stenosis that required surgery. The patient continues to wear the prism glasses.